How you doing, Miss Lewis?
Hi.
All right, I'm Dr. Small.
Nice to meet you.
Okay, I heard you coming in today. Thank you for coming in. Can I ask you, how did you hear about us?
I looked you up on the internet. I Googled it.
Okay, that's great. You go ahead and have a seat.
Thank you.
So I was looking over your paperwork, and I thank you for filling out the paperwork. I know it was a lot of stuff that we had to go over, a lot of questions we had to do. So what I want to do is talk to you about the nervous system. I see you had some issues, your complaint coming in today is you have some neck and some back problems due to an accident you were in. So I got a couple of things here to help me, demonstrate some stuff, and I want you to kind of every now and again glance at the charts to see what's going on. So this is basically an overview of the nervous system and all the nerves that you have, and that goes through your arms, your legs, muscles, and organs and stuff. So what happens is some of these muscles, when you have an injury, they can be through trauma. A trauma can be just something as simple as you tripping and falling off the curb or something, or rolling off the couch if you was laying on the bed, landing the wrong way. It doesn't have to be something as serious as an accident, car accident or something. You can also get sick, when you have things that affect your nervous system. So let me ask you, have you ever been to a chiropractor?
I haven't.
Okay. So have you ever heard of a subluxation?
No.
No. Okay, so in the chiropractic profession, what we like to call subluxations are things, there's something that has caused us a nerve impingement. So I have this partial spine here. So this part up here at the top is like your neck, the bones in your neck. So when you were in a motor accident, you were in a car accident, you had some damage. You probably had some damage, some fluid, some swelling, some blood or something could have piled up in these areas. And you see these yellow lines are coming out, it's like your nerves. So whenever those areas get inflamed, when I say inflamed, they may get swollen, like your knee swells or something like that, if you twist it or something, it pinches these nerves. When it pinches these nerves, they have a trickle-down effect that can affect some of your organs, your muscles, and they also cause pain. So these bones tend to move a little, so what we need to do is introduce a little motion into them to help them to heal on their own. So subluxation can actually start in childhood from like birth. Sometimes you can be subluxated and not even know it. You'll be asymptomatic, which means you're not showing symptoms, but you're having something, there's something wrong. And then you have your symptoms. So like your symptoms right now is your pain, So we're going to address that. We're going to see if we can help you with that. We'll talk about some other kind of things that we call degeneration. You may not be familiar with that, but all it is kind of like if you have a car, it's your brake pads. You constantly use your brake pads and they kind of wear down. So they start out like this thick and they get a little smaller. Well, that's kind of like degeneration. So you're going to eventually have degeneration as you age. But what we do is we remove the subluxations through our adjustments, and it helps to slow that degeneration so it doesn't get as bad and it doesn't progress as fast. So it helps you, perform better and be able to get back to things you do. So I have a question for you. So what do you expect, or what are you kind of looking for with your visit here today and maybe the possible future visits?
Just some relief. I work in a call center and it just hurts. And so I just really need to try to get back to some kind of normal as soon as possible.
Okay. All right. Well, we can definitely try and help you with that. What I'm gonna do is we're gonna do an examination. We're gonna take some imaging, some X-rays, and we're gonna come up with a plan of care for you. And I'm gonna need a little bit of feedback from you on maybe possible, a time frame when you'd like to see some results and stuff. So we're gonna look at some things that we can do. So I'm not saying that we can actually completely resolve the entire issue, but within the first couple of visits and adjustments, you should see some type of relief. If not, then we're going to do a little reevaluation, maybe tweak some plans, and see what we can do a little different. We also have, like, with your impingements of your neck and your back, you also have, like I said, other benefits to that, which you see with the nerves going to different organs and systems. So you may have some residual effects that will help with those issues if they're presented. Also, you have your ANS and your PNS. and maybe a little techy, but you know, and that's all it is. It's kind of like you have your sensory nerves and your motor, well, not your sensory nerves and motor nerves, but you have nerves that run from your brain to your spinal cord, and that would be like your main control system. And then you have your outside nerves, I like to call them, that actually run from your back or your spinal column that goes down to your legs and your arms. Your sensory area and motor area. It's two parts of the nerves. So it's kind of like when you're cooking and you know you're testing to see if the stove is hot, and you reach out and you feel the warmth. That message goes up to your brain, as that's the sensory side. Then your brain sends another message back down and move your arm. That's the motor part, making it move. So when you have a subluxation, it can interfere with that signal, and it causes it to slow down. So you know it delays your muscles aren't strong, your muscles aren't as fast. It can you know dampen some of your range of motion. So next we're gonna do our exam. Talk to you about next time you come in. We'll talk about your reported findings. So when I look at your paperwork and your exams and everything, we'll try and develop a care plan. I encourage you to bring someone with you next time you come. That way, if you have any questions at home that you may have forgotten, you come in, they can help. You know what I'm saying? Maybe they can help you understand you a little better if it's something a little fuzzy about, you're not really understanding. So next time when you come in, we'll do all of that. And if you have any questions or anything for me?
No.
You have like a time frame you think you might like to see some results or something, anything?
No, just as soon as possible. I mean, I realize I can't get fixed in one day, but any little bit of help, it hurts.
Okay. Well, that's great. Well, I want to let you know though, you know, like I said previously, we're not going to do an adjustment today. We're going to just do the exams and stuff, and we'll go over reported findings and bring it back in. You may have some relief after the first adjustment. It may take a few adjustments, but like I said, it should take 2, 3, maybe 4. But first few adjustments, you should see some kind of relief or something. If not, then we'll have to retool some of the things that we're doing. All right, does that sound good with you?
Yes.
Okay. All right. Well, I'm gonna move to the exam now, and you don't mind? All right. Thank you for coming in. We'll just go right in and we'll start.
All right, thank you.